Welcome to Doc Talk. And tonight we have a special program, which is Chat with Doc, where we have an opportunity to interact together. Not only you and I, you as listeners and friends, but also the listeners together can interact. And last night, actually, we were doing just a preamble to this program. Two people actually interacted and exchanged emails, and we'll exchange information as well on some questions that they had. So, welcome. It's a beautiful, beautiful day today. It was sunny. We got our vitamin D, and we are thankful for another day. And tonight is going to be sort of a sunset. So, over the next half hour, we expect the lighting to kind of slowly settle. And it will not, though, fade on the energy that we have to put out truth and to put out ethical, evidence based medicine. So, we welcome you to the program, and tonight I'm going to have several very provocative questions, and I'm being very ambitious here tonight in terms of a lot of the questions that we're going to be asking. But I'm going to go through these here with you, and welcome aboard, Sylvia. Uh, Sylvia has to take her vitamins. So, okay, which vitamins, Sylvia, are you taking? And that's a whole other topic, is vitamins and supplements. So here we are. Mary, it does sound beautiful. We are definitely truth spreaders, and Doc Talk is about spreading truth. And welcome aboard. And we're going to just launch right into some questions here. And tonight, I have a very ambitious set of questions for you, and I want you to participate. Up to now, Doc Talk has been largely about disseminating information. And I've been presenting pretty much didactic lecture type presentations with PowerPoint. And so tonight we'll pause and we'll have an interaction. I want to hear from you. And so please feel free to put in your comments here, and I'll post them as they come up. So, Sylvia, you're taking vitamin D, you have vitamin D deficiency, obviously. Great question. That's a whole other topic, actually, Sylvia. Is vitamin D for two purposes. One is for major affective disorder, such as depression, even mild depression. A lot of doctors are finding there's enough evidence to give their patients high dose vitamin D through the winter months, especially. So, Sylvia, that's a great topic. But secondly, not only for depression, but also for boosting the immune system. And a lot of studies, particularly with coronaviruses, show that high dose vitamin D may, in fact, be beneficial for bolstering the immune system. So, another great topic right off the bat here. We've come up with a new topic, Sylvia. I'd like to share. I'd like to have you share your thoughts, if you like, as much as you're comfortable. Obviously, healthcare information is private and confidential. We protect that unless you're willing to share some generalities, perhaps about the reason you're taking vitamin D. You say you're deficient. Is it causing any symptoms like depression, anxiety? I'd like you, if you can, if you feel comfortable, to weigh in on that question. Okay, so here we go. So here, these are questions that I'd like to cover, and we may or may not get through them all tonight. But the first one is this: do you trust your doctor? Do you trust your doctor? The second question is: do you have faith in your immune system? Do you have faith in your immune system? Next question: what do you believe happens when we die? So, are we physical beings like the evolutionary model? Or are we far more than that? Do we actually have a separation between the body and the spirit? Do we have an eternal soul, for example? And we had a very interesting program with Johnny, who was struck by lightning. And he certainly had a out of body experience and believes very strongly that there is a separation of spirit and body. He actually ascended into the sky. He saw the sun from above, and then when he came backwards, he was resuscitated after 10 minutes of CPR and defibrillation, and then he could actually see himself coming back into his body. So that's another, I think, great question. In my opinion, is do you believe that we have a spirit, and we're much more than physical beings. And then finally, this is a huge topic, and we may or may not get to it tonight, and that is the question of MAID, medically assisted induced dying. And we were seeing this expanded quite significantly to include even potentially children, and to include those that are depressed, that can go to their doctor and just ask the doctor to take their life. Is this compassionate? Is physician assisted suicide or MAID, is it compassionate, or is it doctors playing God? Is this gone too far as control over who dies and who lives, even if the patient requests it or the family requests it? Okay, so we're gonna get. I think you responded here, Sylvia, to the question of vitamin D. And let's see what you have here. I have a new doctor and I trust him. Okay, so we have one vote for trusting the doctor. Somebody else weigh in. Do you trust your own doctor, or do you trust um, uh, other remedies for health that are not even related to organized medicine? So that's a question for you. Okay, so let's just focus in now on one question at a time, and we'll try and stay disciplined here. So, first question is going to be, do you trust your doctor? Let's hear your response. Um, so, Mary says some. She trusts some doctors. So, Mary, maybe a comment. Which doctors do you trust, and how do you base that trust on? How do you know that a doctor is trustworthy? Here's another comment. Some of the doctors have been like family. I've known them for years. So obviously, developing a relationship is useful. Developing trust over a period of time. And Mary, we will get to the maid in a moment. I just want to we'll address one question at a time. And here's a comment from uh, Bear Berry, and Bear says, "I've been without a GP for 4 years now. Yes, I trust my immune system. Yes, I believe we have a spirit, and also there hereafter eternal life. And I think Maid has gone too far." So, Bear, I like your ambition. You answered all four questions in one sweep, in one message. So, can you tell me, Bear, and maybe if you could also comment, when you're without a GP, where do you go for medical help? Do you go to any doctors, or do you try to ignore the medical system and clinics altogether? We have Debbie. This is great. Enjoy everybody coming on here and commenting. We're right off to a very strong start here. So Debbie Morton. Debbie says, my first appointment with a new RA doc asked me if I trusted my doctor. I gave him a steady look in his eyes and said, no. So, it's interesting, Debbie. I actually put a poll out there, an informal poll on Facebook. And I asked people to rate their doctor on a scale of 0 to 10. And I ask you here. So, 0 is no trust. You wouldn't ever go to that doctor, even if you're dying. So that's 0. And 10 is you trust that doctor with your life. So maybe give me a number from 0 to 10. I will try not to bias you with this particular poll that I did, but it was a stark number, shocking number. But I won't. I'll try not to influence your vote on this. So, okay, Mary, doctors I've been able to get to know. They need to be good listeners, and we should be able to try ideas together. So, great point, Mary. So, essentially, I think what Mary you're alluding to is the fact that a doctor will not only listen to you, but will actually communicate with you, dialogue with you, affirm your thoughts and ideas, and not sort of dismiss you. One of the things we hear quite commonly with modern medicine, mainstream medicine, organized medicine, whatever you wish to label it, is that doctors tend to talk down to people. So they talk down to people, they dismiss their ideas if it's anything unrelated to medications, unrelated to organized, structured medicine, the way that it's taught, then they're very dismissive. And it's almost a sense of academic and sometimes even moral superiority. So I'd like to hear your thoughts on that. Do you feel that you're talked down to by your doctor, and does it affect your trust in him? Uh, oh, Bruce, thank you so much. Dr. G.A. Score 10. God bless you. Thank you. Thank you for your kindness, sir. Bruce. I really appreciate you. And Bruce, incidentally, is a Leaf fan, a Toronto Maple Leaf. So, Bruce, my condolences for that. That you're a Leaf fan. I understand they made the playoffs. They clinched a spot. Will they go past round one, Bruce? Will they go past round one, or will they completely collapse once again in the first round? Another entire topic, different than medicine, but also interesting. So I'm in. So I'm actually in a restaurant. I don't know if you can hear. Somebody's having a birthday party behind us. I don't know if you heard the happy birthday to you. Okay, so Kathy Baker, great to hear from you. Yes, so dismissive. So, Kathy, can you share a little bit more? Is this your own personal doctor that's dismissive or consultants? And how does that make you feel? And how does it affect your trust when a doctor is dismissive? There used to be a day years ago when doctors were fully trusted, and patients very rarely questioned their doctor and basically said, "Hey, listen, you're the doctor. If you say it, then that's the way it is. You're the authority over medicine. You're authority over my health." But those days, I believe, are far past us. And it seems to me now people are much more intelligent. They have access to Medline searches, they have access to literature like they've never had before, instant access, and also learning how to do critical appraisal with meta analysis and other things, and learning to look at medicine, learning to look at health with a critical eye. And so I think the days are gone where people just totally trust the expert and without any question. I think that's a good thing. I think it's actually very healthy to have a dialogue with your patients. Wow, the comments are coming in at a fury here. So, Kathy, that's your own personal doctor. Can you just maybe give an example of something specific where he just dismissed you and it made you feel like you couldn't really trust him? So Mary says, if a doctor talks down to you, you don't trust him. That seems to be a common theme: talking down to people or being dismissive. Okay, so let's go back to other comments here. Thank you so much, everybody, for being so engaged in here. So we have here. Here's Kathy back. There are now three female friends with same MD that bring their husbands, and the tone certainly changes. Interesting. Interesting. So you feel that there's perhaps a gender difference when the males are there, that the doctor is more respectful? Is that the implication there, that the doctor is more apt to talk down to you as a female than he is to another male? I'd like to hear your thoughts on that. So Debbie has got an interesting comment here. My GP tried to gaslight me my last appointment regarding the experimental injections. Told me Canadian experts were better than American experts. So that's a controversial comment right there. So I would just say one thing I just want to hone in here. Um, so, with respect to the program Doc Talk, um, it's very difficult to untangle politics from medicine, and that's the understatement. Um, One thing, though, I will say we have to be very careful, and this is kind of just using wisdom, and that is there's certain words. There's essentially a trigger for the so-called fact checkers, which we know what the implication of that is, with respect to information. So anytime the certain words, and I'll just gesture like certain words are mentioned, they don't pick up body language, but they pick up words. So certain words are triggers, and you can imagine what those words are. So I'll just say that sufficient for the time being. There are certain platforms like Rumble that will not censor so far, but of course we know Facebook, YouTube, and Twitter potential targets for censorship. Okay, so back to the question: do you trust doctors? Um, So just gonna get Mary here is making a comment. Debbie, you've heard Canadian doctors putting down American doctors. Also, it's sad, isn't it? And here is the thing. This is part of our programming, and I hate to say this, but we were taught in Canadian medical schools that we were superior to American doctors, and we were told that our regulating bodies are tougher, our exams are tougher, and we are academically superior to American doctors. So that that came. By honestly, if you will, or dishonestly, however way you want to put it. But we were definitely told that we were more superior to American doctors. The stuff we're told, I don't know. I haven't seen any study to prove that. Karen, my doctor wants to prescribe big pharma, is his answer. Well, in my first session on Doc Talk, if you remember, Karen, I don't know if you saw that one, recovering from organized medicine, undoing the programming of medical school. And that's one of the things that is definitely embedded in the brain and the psyche of every single doctor in organized medicine. And if you look back to the history of medicine with the Rothschilds and Rockefellers, especially Rockefellers, that this was a very organized campaign to win over the hearts and minds of medical schools toward the big pharma model. And as part of that was the training to dismiss any alternative, any natural remedy, chiropractors, homeopaths, and that's part of our training. So it's natural and expected that doctors are going to favor strongly the big pharma model and discredit any other model. Okay, I will say this as an encouragement. This is the most number of people we've had so far on the program. So obviously, you're voting with your presence here tonight that you would like to see more interactive sessions. So thank you for that. Um, Bruce, thanks very much for that compliment. I would just say humbly, I was glad that I was the hands that were part of your healing process, and I just say I give God, the ultimate healer, the credit for your healing. Oh, Elizabeth, are you serious about the witch doctors? You trust only witch doctors? Well, that's highly provocative, controversial. I'd like to hear a bit more about that. How you came to trust witch doctors? And I don't know. I don't. Okay. Uh, Thanks for that comment, Elizabeth. We can have opinions that are different. We can have opinions that are completely different than each other. But this is the whole idea: is to have a respectful dialogue and understand why we believe what we believe. Okay, so Kathy Baker, nurse, well-seasoned teacher, and a board of education professional principal, so rude to us. Okay, so I think what you're saying, Kathy, is you're in the education field, and the doctor was talked down to you. And this is one thing, a comment I hear quite commonly, even professionals that are intelligent, they've done their research, and they go to their doctor and they want to have a dialogue, and there's no dialogue. It's a one-directional conversation, and sometimes, sadly, it's dictatorial, and it's dismissive if there's any thoughts that disagree with the doctor's opinion. Uh, Jerome, nice to hear from you. Jerome, it's my pleasure. I always say we're all in this together, if you will, but really, genuinely in this together. It's not a political comment. And that I always joke when I start my talks at rallies and big events. I say, hello, super spreaders. So flip that around them with the fraudulent super spreading, you know, the C, which there's no evidence for if you're healthy. We've seen thousands and thousands of events of healthy people getting together with nobody dying from the C, and I don't mean cancer. And so I would start the event by, "Hey, welcome, super spreaders. We're super spreading truth." And this is what Doc Talk is about: super spreading truth, and in this particular case, truth of ethical, evidence-based medicine, not political TV doctor medicine. Okay. Um, so Uh, Comment from Mary. Uh, Good listener, gifted. Thanks, Mary, for that compliment. Um, and let's go down. Hey, Jody. Wow, we're getting people are coming out of the woodwork there. Hey, Mister. Thanks, Jody. It's great to hear from you. How are you doing up? I believe you moved up north or out east. Anyway, it's great to hear from you. Miss chatting with you. Judy was a colleague of mine in one of my last jobs. So great to see you here on here, Judy. And here is Brenda. Good evening, Brenda. Welcome aboard. Wow, we may need to extend this a little bit. We are getting lots of likes and lots of interaction here. I'm going back to make sure that we didn't miss any comments here. Okay, so here's an interesting comment from Sylvia. Sylvia, thank you so much for your participation. Females definitely get treated differently. I've been refused hysterectomy because I was of childbearing age, but I have BRCA1 mutation and already carried two children. So this is a mutation that's associated with certain um, female cancers or oncology. And I'm sorry I had that experience. It sounds like things were a bit dismissive there. Kathy, three professional women. Um, Now, I'm assuming that the three professional women were the ones that were dismissed until they brought their husbands in, and then the doctors. You seem to imply the doctors took them more seriously, which is very, very unfortunate because obviously, critical thinkers, brilliant women I know that are critically thinking all the time. They're asked great questions. So it's really unfortunate that you had that experience with a different thing. So Lynn Tier, so Lynn doesn't trust her doctors. Can you put a number from 0 to 0? Is you wouldn't take um, anything or anybody or any animal or anything to the doctor. That's zero trust. You wouldn't even go to them if you're like feel like you're dying. So that's like zero trust. And then number 10 is you would trust them with your life. So give me a number, if you will, 0 to 10. Okay, so don't trust doctors unless it's one that actually listens and is open to debate and both sides of the story. Okay, so Lynn, I would agree with you. This is a feedback I've heard over and over again, but good luck with that. Sadly, many doctors will not listen to anything that diverges from big pharma. Okay, Lynn is rating her trust in doctors at a 4, so that's a failing grade. Kathy, looking forward to the afterlife discussion. Okay, so we're going to get to that. So let's go on to the next question. So, but if you want to throw in a number for your doctor, I'll flash it on there, and I'll do a little average. So, next question: do you have faith in your immune system? Do you have faith in natural immunity, or do you feel that there's certain cases where natural immunity is not sufficient to fight off invaders? So that could include everything from cancer attack. So obviously, immune system is a big part of combating cancer. It could also include immune system for coronaviruses, bacteria, um, and general infections. Do you trust your immune system or not? Okay, so let's hear from Karen. Hey, hello, Karen. Welcome aboard. Okay, Karen trusts her family doctor. So, female family doctor does not prescribe unless it is absolutely required. Sister went to her, and when she moved to the area, and the doctor went through her list of meds and wanted to cut most of them out. Karen, keep that doctor. Keep that doctor. That is a wise doctor, minimally invasive doctor that is wise, obviously a good critical thinker, and wants to be non-invasive and use less big pharma, and wants to get your sister off her medication. So I think that's wonderful. Wonderful. Uh, and it's rare, so I would definitely keep that doctor. Okay, so Sylvia, thanks you for your active participation. Good immune system and healthy mind is what our bodies were created for. um, I would agree with that. I would agree with that, that our immune system, we saw in the presentation that I did on the immune system, how we literally have billions of cells that are soldiers, captains, suicide bombers, and intelligence. And every cell has a specialty, and there are billions of immune system cells, an army a massive, robust army of the immune system. And sadly, it's not something that we learn in medical school, the strength of the natural immune system, but we do learn about the, schedules, schedules for, um, well, let's put it this way: they're in childhood, and have been required for school. Okay. Wow. Thank you so much. This we get great participation here. Um, we may need to go a little bit after 8 o'clock if you're willing, because this is very interactive. We can cover maybe at least three of the topics. Okay, Jody, my family doctor gave my 15-year-old son Cialis, strongest dose, big pharma pusher. So no, I don't trust my doctor. I have lots and lots of wow, Jody, that well, I hate to say this. I was going to say it's shocking, but from the stories that we're hearing nowadays about organized medicine, particularly with certain very highly controversial topics like, and that's a whole other topic, but like transgendering and giving children hormonal therapy to feminize them if they're male or masculinize them if they're female. This kind of thing happening at age 12, at 13, 14. So, the family doctor, Jody, giving your son Cialis. Um, so, if anybody is not familiar, Cialis is for erectile dysfunction. And to give a 15-year-old high dose Cialis, wow. To say it's controversial is an understatement, Jody. Uh, Mary, I have found vitamin C, D, and also zinc very helpful. Yeah, and there's actually literature to support that for the immune system as well. Lynn, Tier, eat healthy, exercise, mindset, vitamins, good social connections, and self care for stress. Great comment. I would agree with all that, except sadly, Lynn, we don't get taught those in medical school. We don't get taught about the importance of nutrition, the importance of emotional health, and even the importance of spiritual health. There's actually a physician, an academic physician by the name of Dr. Kronig out of Duke University that has done extensive studies on the importance of faith, faith community, prayer, faith on healing, and significant in randomized controlled studies. He found there's significant improvement in the immune system, even measuring down to T cell, the number of T cells and the T cell response, if people are engaged in the disciplines of prayer, faith, and church community. And he looked at other metrics like recovery from cardiac disease, uh, length of stay in hospital. All those things improved when people had faith and were engaged in faith practices. So it's actually very interesting that you say that. So, Linda, welcome aboard, Linda. So, Linda, I'm going to just change the screen here just to get. So, Linda, thank you for your comments. So, Linda says, a wonderful doctor stood up for truth here in Medicine Hat, Alberta, had to close his practice. I'm not sure where he is now. He's one I trusted in my life. About to meet my new doctor in May. My first question to him will be, what do you think? I won't say the word because we will get censored. But what do you think of that experiment? And if he likes that, I'm walking out. Nice to see you too, Linda. Thank you very much. Linda, one of Linda's, I believe it was your grandchild, was one of the authors of The Children Speak. And so that was wonderful to see you on here. And yeah, that's. I'm sorry about your loss. When you have a doctor that's trustworthy, wow, it's so sad when you lose that. When you lose that doctor. Laura, welcome aboard. Laura Lee Macaulay, natural immunity. Unless you've been very sick, take lots of natural supplements. And Laura, that's a whole other topic I'd like to cover is a naturopathic medicine and its impact on the immune system. And as I say, if you look back at the history of medicine, early in the 1900s when the Rockefellers came and essentially bought over medicine and medical schools. Uh, Naturopathic medicine was actually the standard, and a part of their agenda was to completely discredit naturopathic medicine. Obviously, profit became the driver. Kathy Baker, you faith in your immune system, but one must be well educated. What supports or destroys immunity? Good understanding of functional medicine, something that family doctors are not prepared to discuss and employ. This is postgraduate knowledge study work. Absolutely, and I think it's a fantastic topic. And I think one of the things, if I can say, having been in medicine, one of the things that obstructs doctors, medical doctors, from discussing natural immunity and naturopathic and functional medicine is that they don't know about it. They literally don't know about it. So it's not their specialty, and we're taught that you don't even go there. You don't even learn about it. You don't even critically appraise it. You immediately dismiss it. You just dismiss it because that's what we're taught, and that's part of the Rockefellers' um, program was to get in the minds of medical schools and medical students that we're to discredit anything apart from medicine. Jody Hadley, really a psychiatrist that practiced for years there, was a huge, big pharma pusher. Now is now a woman. What? So the psychiatrist transgendered from male to female. Interesting. Lots and lots of experiences with that doctor as well, and many individuals have had many horrible experiences similar to mine. It's interesting, Jody, that you say that because part of the push now in psychiatric medicine and mental health uh, is multiple medications simultaneously. And so patients that are depressed or have anxiety or have psychosis, they may be on 3 or 4 medications at one time at high doses. And this is what has gotten, again, into the psychiatrist's minds through quote unquote education, um, driven by big pharma, driven by pharmaceutical research mostly, that says, oh, it's not good enough to have one antidepressant. You should be on 3 or 4. Um, Now, this is also another topic, Jody, for a whole session um, about the imbalance. Some people say to justify antidepressants, to justify psychiatric medications, they say, oh, you have a brain imbalance, and so we must balance it with medications. We'd like to have a topic to actually critically appraise that. Is that really true? Is there any evidence that there's actually chemical imbalance in the brain that justifies psychiatric medications? It's a great topic to address as well. Jerome, amazing to hear that. I'm assuming you're referring to the strength of the spiritual practices like prayer and fellowship. Jerome, just maybe elaborate on that with respect to enhancing the immune system. Jody, once again, don't trust the mental health field either. I think you're one of many people that feel the same way. Okay, so Lynn, my doctor told me I knew more about nutrition than he learned for sure, and you're a registered holistic nutritionist. Maybe Lynn, you can pop on as a guest sometime. Just message me. I'm gonna put up my address here. Doc Talk with Dr. G at gmail.com. Feel free to message, please, Lynn, and maybe we can have a discussion about holistic nutrition and bring that into one of the sessions. Okay, Lynn. Okay, I'm gonna just take this banner down. Wow, this is I really appreciate all of you here today. It's absolutely a fantastic program. It seems to me like we've struck something here that is of interest, and that is an interactive discussion. While didactic sessions, I think, are important, getting information out there, sharing information, it seems to me like this is resonating much more with you. So thank you so much for that. Thank you for bringing this forum for open discussion. Lynn, you're very welcome, and thank you for your very wise and insightful comments. Brenda, I'd like to know about that as well, chemical imbalances in the brain. Um, Brenda, we're definitely going to cover that as a topic because it's highly controversial. So it's been used and again taught to us in medical school. There's a chemical imbalance of the brain, but has it actually been proven? That's the big question. Hey, Christina, welcome aboard. Christina from Port Dover area, Ontario, beautiful Port Dover. I'd love to get off my biological. I've tried diet, supplements, etc., leaving the door open for any advice. I need my immune system to fight off viruses, etc. Absolutely, absolutely. And again, another great topic is boosting your immune system, specifically for fighting off things like coronaviruses. Brenda, I'd like to know about that as well. Chemical imbalance, absolutely. I think that's a great topic. We'll make sure we cover that in the next few weeks. Uh, Mental health, the role of pharmacologic medications, and whether there's any proof that these there's chemical imbalance and that we need those. Karen, mental health improved when I started eating real food and got off sugar and processed food as well. It reminds me of a story of a patient that came back to their doctor and they said, "Hey, how are you doing today?" And the patient was like, "I feel great, doc, now that I'm off all the medications that you gave me." Maybe not that far from the truth, and we've seen many people get off medications. Kathy, work with Dr. Mate, Gabor Mate, with the impact of trauma would certainly be interesting discussion when it comes to depression and anxiety. Absolutely. Thanks, Mary, for your comment and your support. Brenda, my daughter was diagnosed with schizophrenia. Thank you. As I'm here at Symposium in Barrie, Ontario, and I'm getting some great service. I just think I'm transitioning now to decaf coffee, or else I'll be up all night. So, really enjoying this program tonight, and I hope you are as well. My daughter was diagnosed with schizophrenia. Yes, I'm sorry to hear that. Now, there are. I don't want to be dismissive of every big pharma intervention. There are cases with severe psychosis where there may be a role for an antipsychotic, particularly if there are safety issues. Um, Open forum for public with a great doctor. Yeah, Sylvia, here's the thing I think we're going to be seeing in the next few years. We're going to see, I believe, and it's already in evolution, a parallel system that is going to go outside the box of organized medicine with regulators that are, most people would say, dictatorial. They say this is the way you're to practice. You're not to question that. If you question that, we're going to prosecute you. We're going to actually persecute you and shame you for daring to question us, daring to look at the literature, daring to diverge from the specialists that we choose, the treatment that we choose. So it's a very dangerous path. And so many doctors that are ethical have actually been attacked by regulators and have had their licenses revoked and in some cases restricted. But there is an army of ethical, evidence based doctors that are out there. And let's just put it this way we are looking, I say collectively, not me personally, but the ethical, evidence based physicians are looking to establish a completely new system outside the conventional big pharma model, outside the heavily regulated and heavily controlled organized medical system. Kathy, thanks, Ahmed. We'll come back again for discussion. Thank you for coming on board. So, yeah, it's we're past the hour. Well, I think that it would be unfair to try and cover this huge topic. What do you believe happens when we die? I'm going to suggest this. This has been so popular today that I would like to address this question next week, and that is, what do you believe happens when we die? Are we just purely physical beings that just go into the ground and decay, or do we have a spirit? Do we have a spirit that's separate from the body? Do we actually end up going into an eternal resting place, as many people worldwide, billions of people worldwide believe? Or is it, as atheistic scientists would say, we're just organic, we're just random physical beings that got here by chance, and we're just going to go into the ground and decay and die, and there's no spirit? So that's going to be a great provocative thought. And then, of course, this is a huge topic, which is medical assisted induced dying. Is it compassionate, or is it doctors playing God? So I want to thank you very much for your participation. This has been a great program. I really, really enjoyed this here today. And I just want to say this also as well to you, if I could, and that is this: is that um, we also have the opportunity to do one-on-one coaching. So one-on-one coaching is that this is kind of like an expansion of what we did here today, except it's one-on-one, so it's very focused and very targeted. And I've had the opportunity and the blessing of actually connecting with people one-on-one, and I just wanted to share a couple of comments, because I think it's been mutually beneficial. I've really enjoyed the opportunity to share what I've learned through psychology, what I've learned through medicine, surgery, clinical research, having published numerous papers and peer-reviewed journals, and now theology. Now, I don't say this to boast. I actually say it very humbly. I feel very, very blessed to have had these opportunities, to have such a mixed educational background. And I feel blessed to do it. I'm not boasting. I'm not saying I'm superior academically or morally academically superior to anybody, but I do have this opportunity, and I believe a gift that I believe I've been given to share knowledge and to communicate knowledge. So this is a couple of people that I've been able to help on one-on-one. This is one comment to some reviews, suggestions, and opinions gave me much needed strength to try to resolve this by a different approach. So this is a lady that was going through a very high conflict, high stress divorce, and we had a 30-minute one-on-one session. Teleconference, actually video conference, and we're able to go through how to cool the temperature in a heated, high conflict divorce. So she just said it's good to have support from unbiased person and non-judgmental. Blessing, Dr. G. And then there was another lady that was able to help, and this is her comment here. Feel relieved Dr. Gerges took the time to answer my health related questions. 30 went through all recent hospital reports, invested a considerable amount of time asking me for pertinent details as well for all the questions. So again, I say this just to emphasize that if you would like to have a more focused one-on-one sessions, and where I can do the research on your behalf or walk you through or navigate through the research, having had the opportunity to learn very structured, evidence based, ethical medicine, to be able to go through, find those articles that are high value, that are not laced with conflicts of interest, to answer any question that you might have for yourself or for a relative. So please feel free to contact me at doctalkwithdrg@gmail.com, and we'll talk about focused one-on-one sessions. And please remember, this program is supported purely from donations. It's listener supported. So please consider an e-transfer support to doctalkwithdrg@gmail.com. Any donation over $60, and I will send you both books, Life in Medicine and The Children Speak, with shipping all included. So it actually ends up being less expensive than actually purchasing books directly. So that's an incentive for supporting the program. And thank you so much for your support tonight. So we have gone about 15 minutes over. Obviously, huge topic. Brenda, thank you as well for participating. I appreciate that. And Mary, thank you so much. I'm grateful if you feel that I'm gifted in this area. And Jody, great to see you, hear from you. Miss you so much. But you say you moved out east, so New Brunswick, and I hope you're doing well there. Email me, okay, and or message me through Facebook, and just give me a report on how you're doing. So thanks, Mary, for your ongoing support. Mary Elizabeth, always very supportive. Thank you so much. And Kathy, we'll come back for discussion. Okay, so it looks like we have the momentum to continue on next week with another chat with Doc. So next week we're going to cover another topic, and that is the continuation of this, which is going to be two questions. One is, do you believe that we are more than just physical organic beings? Do we have a spirit, and what happens when we die? That's the one question we'll cover, and then we'll cover the very controversial topic of MAID and whether it is compassionate care or whether it has gone too far and it's physicians playing God. So again, thank you so much for coming on today. Thank you for your active participation. This is Dr. Emad G reporting from Coffee Shop in Barrie, Ontario. And remember, next week, 7:30, we're going to have another interactive, stimulating, highly stimulating talk. I thank you so much for your participation today. I had so many comments. It was like, I was going to get like carpal tunnel syndrome, like just from repeatedly pushing the button. But I like that. That's a problem that I like, is having active participation and trying to keep up to your pace of great questions. And may you be blessed. And please tune in next week. We'll continue on with another chat with Dr. G next week, 7:30, Doc Talk. And may you be blessed tonight. Have a great evening, and we'll see you next week.